good to see you again. Let me, real quick, before we dive into everything, get your vitals checked again. I know I have so many different things around my neck. When I used to work at the hospital, I would get neck pain at the end of the day from how many different instruments I was carrying all the time. So this is just our little oximeter. It makes nice, interesting sounds, doesn't it? With our little oximeter, I'm going to have you put it on your finger. It's a lot quicker than getting your vitals another way. So I'm just going to have you put your finger in here, just like that. You see that? Just like that. And it'll read your pulse and so forth. So anyway, I'm going to go ahead and put that on you. Ready? There you go. Okay, and then we'll just wait. And keep waiting. Oh, the bird, jungle clinic next door. Your saturation of oxygen is 100%, and your actual pulse is 75. That's perfectly normal. My medic got your blood pressure read as 120/80, which is absolutely perfect. So I know that last time at the end of your visit, we had finished your diagnosis with your different Vanderbilt scores and everything else. And when we did that, we kind of went through your diagnosis with the DSM-5. And if you have any questions about those processes for me? No? And you had mentioned that your little sister was also curious if she had ADHD or not? Okay. Have her follow up and we'll do a full diagnosis visit just like we did with you last time. But today is more about treatment. I know you said you weren't very interested in medication. You had had medication as a kid and it made you lose a lot of weight. We can find alternatives. There's a lot of other, I think you said you were on Concerta. No, not as a kid, right? You were on Adderall. Okay. And that's fair. It's totally reasonable to have concerns about those medications. If you change your mind later, we can do a more in-depth medication consult and just go specifically into medications. I agree with you. That's totally fine. If you want to start with more behavioral modifications, more therapy type things, we can start with that. I can also give you some diet ideas, and we can kind of go a more natural path. Okay. And then next time, if we want to step it up and include a medication, I'm very comfortable prescribing those and I can help you out. Okay? Alright, that sounds perfect. Now, I actually do have, I've been looking into a bunch of other possibilities for you as far as ADHD based on our conversation last time, okay? So, let me get those out for you. Just in case we have to do medications later on, at the end of this visit, would you be okay with getting an EKG taken? Perfect. That's just because some of these, the kind of uppers is really what they are, the stimulants. They can have effects on your heart if you have an unusual heart already. And so we just want to check, make sure your rhythms are all normal. Is it okay if I listen to your heart and lungs before we go on? I know I do things a little out of order. We're a little bit more spontaneous. As you can see, I'm sure that you don't frequently see physicians with a bird on their shoulder. Hey, little one. She's very bitey today. But so in our procedure rooms, obviously, we have everything all cleaned and the birds are not allowed in our visit rooms. We found them to be very helpful for our patients' mental health. You don't like the tapping, do you? I like the tapping. She hates tapping sounds. Alright, I've actually set aside basically a list of treatments for you that I'm very excited about. Okay? The first one that I wanted to talk with you about is omega-3. Give me just a second to get myself set here. And I'll listen to your heart and lungs, and then we'll go in more in depth over these treatments. Okay? Tell me, how's your family doing? Yeah. That's hard, I'm sorry. I have actually been there before. You are not alone in that one. Really? Oh, okay. Well, fair enough. I understand how you might feel that way. Sorry, I'm still listening. I'm just checking something. I'm always listening. That sounds very creepy, doesn't it? Sometimes the fact that you can pay attention at the same time, whether you can't pay attention to one thing, it can be used as a gift. You can use it to your advantage. Given the right question, I know that you've been having trouble now at work and at school, but we can deal with that. And think of it more of a superpower. You're just neuroatypical. You just aren't exactly the same as everyone else, and that's okay. You don't have to be the same as everybody else. So sometimes it's that the circumstances need to change, not that there's something wrong with you. Sometimes you need a medication push to help out. There's options, is what I'm saying, and that it's not all bad. Don't be discouraged. All right, let's listen to your heart. Oh, this I know. This is a little EKG measurer. It's got all, and of course my little patch that says position. All right, here we go. It makes these lovely, lovely sounds. I don't know if you can hear, but it makes really good sounds. Alright. Oh, that's uncomfortable. I can't hear. Sometimes I let people listen to their own hearts, usually children. Here. I don't know if you can hear this. Okay. I'm gonna see, maybe if we can set this up. Let's see if we can set this up so you can listen to your own heart. Ready? It's sometimes hard to isolate the heart sounds outside of the breath sounds. The heart sound is the lower sound. It's the one that's like almost a footstep. That's cool. I think the human body is fantastic and fascinating. This is not about that. This is about you, right? I have a little book here of a couple of things that I've had prepared. So they've found that because exercise increases some of your brain-derived neurotropic factors and like enhances neurogenesis, exercise is actually a reasonable treatment option. Enhanced neurogenesis, making more brain parts, basically. That's maybe an oversimplification. It improves overall cognitive function, as well as attention and memory, which obviously is something that you're struggling with. Let's try 30 to 60 minutes daily. Let's increase it little by little. Start 10 minutes a day and up it. There are some activities that are currently being studied may be more useful for ADHD than just your standard exercise, such as yoga, tai chi, because they affect balance, right? Balance and midline coordination. The metronome method, you can look up and see if that's something that would work for the brain gym. Okay, so these kind of exercises, they help enhance focus while enhancing balance. Children with ADHD later on, you may find it, or if you teach at a school, you might find it helpful to incorporate activity bursts in the classroom. That's the ABCs. Basically, structured moments during class where you stop and you do some activity bursts, get those jiggles. And you might find that helpful with your own children later on if that's something that you're thinking about. So, goals for treating ADHD, right? We have to come up with what your goal. What do you want to be more able to do? I see. Fair enough, that makes sense. Alright. Thing that will help and support that. Persistence in the presence of difficulty is a way to think about that. Organizational skills, short-term memory, all those kind of things. That totally makes sense. Right? At the basic brain level, some basic requirements or elements of quote-unquote paying attention. Right? One of them is motivation. Obviously, it's easier to pay attention to things that interest you. The ability to perceive sensory data, such as sounds, as words and symbols, accurately and process that data into meaningful information. The ability to tune out irrelevant sensory data is necessary for concentration, right? It's hard to ignore music or conversation in the background while you're reading a book, right? And at the same time be flexibly responsible to changing priorities, right? You might hear a cry for help. Can you pay attention to that, or are you too distracted? I know we're going very in-depth here, but since you wanted to do kind of alternative, I want to kind of help you structure your own treatment plan and how we're making these things. The ability to monitor your own attention as well. Are you able to notice, oh, I was focusing on this instead of that, or how many times have I read the sentence? You have to be able to notice things, right? And boom, everything changed all of a sudden. It couldn't possibly be because I had some very noisy birds yelling in the background, and I wanted you to have a slightly more relaxing experience than that. That can't possibly be why, right? Alright, let's keep going, and let's try not to wake them up. There's things like sounds, other such. Do you hear that? The rustle of wings. I have the most complicated clinic life ever. You have no idea. And yes, this is a highly ADHD distractible video. I think that sometimes you have to be okay with distractions and jumping around, and it's unfortunate that our society is so focused on keeping everything a certain way. In order to be successful nowadays, you have to have some element of being able to switch your attention rapidly and hop around, but you also have to have a level of concentration that was not expected of us back when we're, farming. You can think about whatever you want while you're picking up, weeds to an extent. Otherwise, you're going to pick up the flowers too, right? And that's what we want to make sure you're not doing. I want to make sure that you're not picking up and throwing them away, that you have enough concentration that you can, destroy the weeds and enjoy the normal parts of life that you like without missing out. So that's, my goal is not to eliminate the things that make you unique, which I think is sometimes the goal of some mental health professionals. I say this from experience. As you can see, I'm a very unusual and different specimen of a physician, and you can look, I have my license number, NBI number right there below. You can look me up. I am different, and that's okay. And you are different, and that's okay too. So be comfortable with that. The goal of ADHD treatment is to help you focus more, okay, on the things that you enjoy so that you don't miss out. You have to be able to follow directions, right? Following directions is definitely not sexy. Hey, buddy. Come here. This is difficult. That's cinnamon. Obviously, if you need, I can put in a referral to a behavioral health expert, somebody who can sit and work with you. I think that's perfect. That, and they can kind of help you figure out what organizational strategies and other kinds of things are going to be best for you. I think we already talked about exercise, right? Roger that. That's awesome. Make that happen. Safety. When you're engaging in activities, or when any of your little ones, if they have ADHD, sometimes it's prominent in families, sometimes it's not. But there's a lot of discussion about how much environment impacts ADHD development versus how much family, and people in the same family often have the same environment, right? So it's hard to tell how much actually has a genetic component. But if you have little ones, make sure that when they engage in activities like sports and everything else, try to encourage small supervision ratios, right? And same when you're in classes, any classes you enroll in, if you do, skateboarding, yoga, martial arts, you are best off and will have the best learning as well as the best safety in smaller classes. So that's another way you can kind of adapt your life to make it more ADHD friendly, right? I know I love the sounds of paper. This is my little list and booklet of things, because sometimes it's hard since I am also distractible. Again, I don't have an ADHD diagnosis, but I'm also a distractible person, as I'm sure you've noticed. And it's much easier for me if I know where my resources are, what I need to get my goals accomplished. And I keep a lot of them organized by having physical books still. A lot of physicians are putting all of our resources into cell phones and so forth. And I'm a little of a crazy person who thinks, like, what if an EMP went off? Then I would lose all of the medical knowledge that I cannot automatically keep in my brain. Obviously, we try to keep most of as much as you can in your brain. But having a list, having a place where it's organized, you can remember, oh, I have to talk to them about this. Oh, I have to tell them about this. That's helpful, right? So that's an organizational thing that I do in my own practice. Whatever works for your practice and your employee, right? Another thing that might be helpful is in your job or workplace, looking for career options and workplaces that allow you to have a very structured schedule. I had one military doctor, one military physician told me that he thinks, and he's found in his experience, that patients with ADHD do very well in the military because that alertness, that ability to notice a lot of different things, I mean, you can imagine how that could be helpful in a dangerous situation, a combat situation, something like that. But the military is also highly structured. You're supposed to get instructions of what you're supposed to do at all periods of time, blah, 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 blah. I think he may be correct. I have seen, I have patients with ADHD who are in the military who are incredibly high performing. I've also seen patients, because of the emphasis on conformity, have some struggle occasionally fitting in, but I think that's something everybody deals with in that organization. So it's something to think about just when you're thinking about and evaluating your job choices. In addition to evaluating what you enjoy or what kind of career goal you'd like to establish, evaluate, is this good for my ADHD? Is there a good structure? Can my ADHD help me in this job? Can it give me the ability to see a lot of different things that I might not otherwise see, right? That's to your benefit. So find ways to benefit yourself. I think that's all I need to say about that. Sleep is the next really big kind of integrative alternative. I know you thought this was going to be all about herbals, but actually retraining the brain is a little bit more complicated, and it involves all areas of life, right? So sleep deprivation impairs your focus, your organizational skills. It makes it difficult for you to redirect yourself, okay? There's evidence about sleep impairment affecting your ability to perform automobile tasks, right? Your ability to perform at work. And people who are sleep deprived usually believe that we are the exception and not the rule. And so we tend to believe, oh, no one can tell that I'm having performance difficulties. I don't have a big performance change when I'm sleeping or not sleeping. There was a large study that found that basically found that we are underestimating our own performance impairment when we don't get enough sleep. Now, it's hard to get enough sleep. It's easy to get distracted from the task of going to bed and stay up late on the phone, looking at internet things or looking at video games or something else like that. We can do an entire visit about sleep, if you like, and how we can improve your sleep. All right, I'll put that down too. Let me write it down. Perfect. I'm basically making a little list here on my little sticky for you, okay, of things that we will basically enact, okay? All right, let's talk about nutrition. This is a fun one because there's so much debate about this among physicians when it comes to ADHD, right? So your brain uses between 20 and 30% of your body's ATP, or energy supply, right? That there's just a very high density of there's certain molecules that there are more of them in your neurons than there are in the rest of your body, right? Those, they suck up energy, right? understandably, right? So you can get tired and actually burn calories with your brain. So if you have impaired nutrition, by impaired nutrition, I don't just mean the amount of calories, I mean the quality of the calories that you are receiving. Are you getting calories that include a high number of coenzymes? Now, the functions that your brain has to undergo require an excess of alternative metabolic pathways. There are some very complicated and specific chemical pathways that happen in your brain more than anywhere else. But everywhere in your body, those other pathways to get things done, right, to do all the extra things you have to do besides just breathing, all of those pathways include or need coenzymes, right? There are specific coenzymes are like the helpers to the main molecules, basically. Another word for coenzymes, well, in nutrition, can be vitamins. There's certain vitamins and minerals that you need to help these processes go more smoothly, right? Really? Well, good. Yeah, exactly. So you kind of already know a little bit about that. Absolutely. Well, we can also do an entire nutrition visit. Just like I said, we could kind of do an entire sleep visit. A nutrition visit wouldn't be out of the question either. Oh. Okay. Sounds good. Let's make it happen. Right. The other, but I will go on before we go, and I'll start writing down a couple of things that you can start now. How's that? Perfect. Okay. So, steady supply of glucose, which may mean eating 5 small meals a day instead of 3 big meals, right? Because you keep that glucose supply steady to your brain, right? So you can write this down too, or I'll write it down and give it to you. The act of writing something down actually helps you remember it better. So, somebody with ADHD, I highly recommend you carry around a notebook and a pen everywhere you go, and you just write everything down. You have lots and lots of reminders to yourself, and at the end of the day, you check over it, see if there's anything you missed. At the end of the work day, at the end of your lunch periods, just check in. What have I missed? What did I need to remember? It helps a lot. So, getting a steady stream of glucose, 5 meals a day instead of 3, perhaps. Getting those omega-3 fatty acids. Now, there's actually studies that low levels of omega-3 led to behavioral issues in children. Omega-3s are these fats, again, used mostly by your brain. So, you can use fish oils, okay? There's also some evidence for, so flaxseed, walnuts, green leafy vegetables, they contain omega-3, but they contain the kind of omega-3 called linoleic acid, and humans only convert about 5 to 10% of that linoleic acid into the omega-3 that you need, which is the EPA, the eicosapentaoic acid, and DHA, which is the other one. They all have crazy long names. That one's like docosahexaenoic acid, right? So basically, vegetable omega-3s may not have everything you need. Easiest place to get it, tuna, mackerel, sardines, twice weekly, okay? Or you can do 1 to 2 teaspoons of flaxseed daily. And you just have to increase the amount if you're going to get it primarily through vegetable, because I totally understand if you want to do anything vegetarian. And like I said, when we go over your specific diet, we will modify everything to your specific needs, right? Vegetarian or so forth. Are you? Oh, interesting. Totally interesting. So fish is pretty much the healthiest protein that you can consume, not just for omega-3s, but for other things. But there are always alternatives as well. Okay, you just let me know. So 500 and 2,000 milligrams of EPA and DHA is what you need pretty much daily. And you can get a supplement if you can't get it naturally from your food. There is a lot of evidence that supplementing is not as effective as getting it naturally from your food. Because you think about it, your body wasn't designed to be eating pills designed by whoever. Your body naturally adapted. All of us, ethnically, geographically, racially, we have adapted in some ways to the foods that adapted and evolved along with us, right? So having access to food, and obviously that's over a long period of time, that's not me specifically, although I do specifically adapt to the food in my area because I like food, but you know what I mean. You and the world around you are not separate. We're as separate as we tend to think. So the way that your body has developed, the way that it was designed, is to eat food that is food. Which I feel like I have to argue to defend that. I shouldn't have to. I think that it is fairly common sense, right? But who knows? Okay, so omega-3s. Have I got you sold on omega-3s? The other thing, amino acids, there are 2 small studies that suggest carnitine supplements. They can help improve attention, behavior. They're both done on children, right? Because again, a lot of people are looking at alternatives, especially for children, because like your concerns for medication, right? Absolutely. There are still a lot of studies that need to be done, though, for amino acids like carnitine to see about the dosing, frequency, everything else. Again, if you can just get a lot of protein in your diet, make your plate half protein, half vegetables, with, maybe only a little bit of those vegetables having carb, a high carb content. Potatoes and things like that don't really count as vegetables. For those amino acids, if you can get soy, tofu, bean, lentils, seeds and nuts, milk, eggs, what else? Oh, fish, fowl, meat, all those kind of things, right? Cheese. A lot of those amino acids. To get your essential fatty acids, that EPA, DHA, linoleic oil, in addition to the ones we've already mentioned, you can actually add some dark green leafy vegetables. Animals that have eaten omega-3 rich diets, there is evidence also you can steal the omega-3. So chickens who've been fed flaxseed, pasture-raised bison, or lamb and beef, wild game. So if you hunt, if that's something you're comfortable with, eat more of that. It's good for you. B vitamins like folate and B12 is another thing that you need a lot of. The B vitamins are essential cofactors to your neurotransmitters, okay? Many children, especially who avoid leafy vegetables, they don't get enough folate. If you're a strict vegan, B12 supplementation, okay? Unless you are a plant-based expert and know how to get those B vitamins yourself without a supplement, which most people do not. It is possible, and we can do a consultation specific to diet. Picky eaters may have to have a multivitamin. Don't take extra multivitamin. Actually can lead to side effects, and you can die if vitamins. Vitamin E in particular can be dangerous. So I don't even recommend that people take vitamin E supplements. I recommend most people don't eat an ibuprofen with every visit, every meal. Anything that's a real medication, anything that actually works, can have side effects. There's no such thing as a natural solution that can't have side effects. Okay, it may have few side effects or less side effects than a standard medication, but if it works, it can also hurt you. That's how the world works. Everything has a yin and yang to it. Water. Dehydration impairs attention. There was a study of first graders where ingestion of water before taking a test led to better attention and greater happiness. So take some water. Absolutely. Water. I prescribe lots of water. At least 6 to 8. So those 6 to 8 ounce bottles? Well, not 8 ounce bottles. A standard water bottle, right? Sorry, I'm a doctor, not a water bottle expert. A standard water bottle. 6 to 8 of those a day. More if you're going to have a high performance activity coming up. It's fine. No, you can go ahead now. Oh, going back to the vitamins. Oh, absolutely. There's a lot of places you can get that in your food. Beans, lentils, nuts, seeds. Are you writing this down? I'll write this down for you. Beans. This kind of digital be a little odd, right? And I'm a little bit of an odd person. I get it. Go ahead. Oh, go ahead. Well, also leafy greens have a lot of B12 in it. Asparagus, oranges, and other citrus fruits. I actually have some oranges right here. You didn't think I would be that prepared, would you? Oranges make a sound that I like. Isn't that silly? You've never, ever had making sounds on your oranges. Let's see if I can juggle them. I have 3. Oh. Anyway, oranges. Very good. No, I'm not going to eat them in front of you. I don't do that. I think that makes me uncomfortable. Oh, one more time. Things that require constant out, like juggling, really good for your brain to learn and practice. Another thing that's maybe useful to learn, knitting, crocheting, these that take, I wish you do the same one each time. It's good for your brain. Like, do brain training every day. Every day do something that requires your brain to concentrate in a different way. I've never heard of that kind of stuff, have you? Juggling. So whole grains instead of the white flour, yeast, like brewer's yeast. Yours can be good. Dairy, eggs, poultry, fish, and shellfish. Minerals. There's also some minerals that are helpful. You can do a visit about iron deficiency specifically. There was a study that it impairs concentration. Because, you need blood to your brain that's working. And iron helps your blood, basically. It actually affected memory, concentration, behavior, physical, and mental performance. Peas, beans, lentils, peanuts, peanut butter, leafy greens, spinach, avocado, raisins, whole grains, brown rice, cashews, almonds, ginger. And then we're back again to the dairy, eggs, meat, fish, poultry, and oats. Put together your exercise plan. We can do a special visit just about exercise. Okay? We're not very accustomed to it, but 30 to 60 minutes every day. Different than the amount I prescribe for depression. It's different for exactly what's needed for heart health. There are at least a dozen double-blind studies that have found that sugar does not cause hyperactivity. It's not true. However, eating simple sugars too much can cause these really fast blood sugar swings. Because when you eat something like candy, I have a candy here. This, you can get a little burst right before a test, right? So right before a test, drink some water, okay? Have a candy. I'm having a ginger candy. Ginger is good for nausea, which I have a little bit of right now. And for a couple of, other things. We'll talk about ginger one day. Not today. So adding a little candy, you kind of increase that. What a pretty wrapper, right? The simple sugars in that candy will break down during the time you're taking your test. You get that boost, but then it'll be gone. It's not good for lasting long-term glucose up in your brain. And when you get that sugar down, like withdrawal, you get irritable. Brain function doesn't work as well. So you need something that's a complex sugar that's consistently working in your brain all day long, right? That's why eating high value meals during the day, right? They're going to be more helpful to you than snacking on sugars and so forth. So try to get complex carbohydrates. They are literally complex. It's distracting me also. Thank you for pointing that out. Painting from an artist who happens to be deaf here in Pyeongtaek, South Korea. And my theory, I'm now sitting on all these oranges. My theory is that his colors are so much brighter and more beautiful because he has other senses compensating for the lack of the one sense. That is my medical theory about why I drink it. It's an oil painting. It's gorgeous. Okay. Back to you. Sugars. Complex carbohydrates literally means that the molecule in the carbohydrate is more complex. It's got all these different branches versus a simple sugar that might just be like one little molecule, really easy to break down. Furthermore, many sweet processed foods also contain artificial colorings. Now, there is evidence, and I can link the studies below. There's so much debate about these artificial colorings. Right? A lot of physicians will tell you there's nothing. You have to evaluate it for yourself. Anything I tell you, I'm always going to tell you, look at the evidence, figure it out. Because a lot of times there's evidence from multiple perspectives, because the world is more complicated than the simple pictures of the broad brush we try to paint it in, right? So, the things that have been found to worsen hyperactivity for many people. Petroleum-based FD&C and DNC colors, artificial flavors, BHA, BHT, DBHQ. Again, we can't paint these with a broad brush either. Right? We can say, oh, all artificial foods are bad for us. Most of the medications I give out are also artificial, and some of them save people's lives. So, the artificial sweeteners aspartame, now called neotame, and allatame. Not all artificial sweeteners. I haven't read anything about sucralose being harmful to somebody with ADHD. Again, that may change. The Center for Science and the Public Interest has actually even called for the FDA to ban certain colors, specifically blues 1 and 2, green 3, and this is where I have to consult my list because I can't remember these colors. Write them down. Again, put it in your notebook so that when you're shopping, you can look in your notebook, oh, these are the things I'm not supposed to have. In fact, I have them in it. Use these. Isn't this lovely? This is a weatherproof notebook. Oh, actually, you can't use it as a minute. Right. You write down little thingies. Okay. This is weatherproof too. Neat weatherproof paper. If it rains on it, it won't melt. Happy stuff. Write it down in your little note. Okay? And the things you will write down so that you can compare to the back of your food. Your purchase are going to be blues 1 and 2, green 3, orange 8, reds 3 and 40. Okay? Yellows 5 and 6. Right. The diet that restricts these things that I just mentioned, it's called the Feingold diet. There are studies of children who received the Feingold diet, and 73% had improved behavior. There was a study involving more than 1,800 children that showed significant improvement in hyperactive behavior on a diet free of benzoate preservatives and artificial colors and flavors. And yes, I absolutely consult the literature. Right? Don't trust a physician who does not consult the literature, who doesn't update, who doesn't learn new things, because we are learning new things about medicine all the time. And if we don't consult the literature, we as a community are failing our patients. And sometimes we don't have time. Right? Sometimes we don't have time to be consulting the literature. That's the unfortunate truth. There are ways to help your physician get more time to spend on you. We'll talk about that in another instance. Or we will plot to take down the medical establishment so that physicians and patients can work better together. We'll do that. I have so many exciting things. Okay? Sometimes it might be overwhelming. This is overwhelming. I'm glad you're so excited. You're so motivated. Okay? Being motivated about your health is not a bad thing. It helps you to perform better, to help others. The better you can perform, the better your community works as a whole. So, I'm not a big fan of selfishness. I'm not a big fan of taking care of yourself just for yourself. You are welcome to disagree with that philosophical thing. I'm a really big fan. Taking care of yourself. But you can't help anyone if you don't take care of yourself. If you don't take care of yourself, you are harming a precious resource. You are a precious resource, an asset to the species. With or without ADHD. In fact, it may be the reason that you have the brain you have is because for the purpose that you've been put here, that is the brain that is necessary. So don't be down on yourself. Find a way to use your powers rather than disliking them. That's what we're here about. Roger. Okay. Caffeine. Talk about it. Don't worry, I'm not here to take away your precious coffees. I will take away your precious sodas that send to me. Caffeine actually improves attention better than placebos, not as good as prescription medications. I know I keep getting on that. I'm definitely not trying to push you to take medication. I just want you to have the facts. Some families even use caffeine as a supplement for their stimulant medications. Green tea contains caffeine and also some of these amino acids that you need for that kind of long-term performance. And you also, specific theanine is in green tea, which counteracts that jitteriness you might get from coffee and that kind of hyperactivity. Some people have the attention deficit kind of ADHD, and some have the more hyperactive kind, right? Get that feeling of calm. Obviously, side effects: insomnia, jitteriness, palpitations, butterfly you can get from caffeine. It can be addictive. Withdrawal symptoms can occur with as little as 1 to 2 cups daily. Caffeine is a real drug. People don't realize this. It is a drug, and you can be addicted to it. It's interesting, by the way, that our society is okay with addictions to some drugs, but not others. I won't go into that further. I will not open that can of worms. I said it's interesting. I did not say I agreed or disagreed. We're not making any political statements here. Caffeine is not a good substitute for getting a good night's sleep. Okay, that is straight from Dr. Rakel. Is not wrong about that. Food sensitivity: 6 to 10% of children actually have allergies or sensitivities to food. You may too. Do you need to be tested? No. Allergy tests may be negative even if food is problematic to you because you may not be allergic to it. You may just be sensitive to it. So getting allergy testing might be totally useless to you. What you need to do, basically there's no substitute to listening to your body. Try restricting down, limit your diet, try having chicken and spinach and then add things in and see what kinds of things affect you. What kinds of things make you not. So, if you suspect a sensitivity, I'd recommend taking a food diary. And on your food diary, you're going to write down several categories. 1, how I felt today, how I behaved today, what I ate today. And in that how I felt, it needs to be both physically and emotionally. Did I have a rumbly tumbly today? How many times did I go to the bathroom? That's important. You need to pay attention. Okay? So, some studies have found that oligoantigenic diets, which are diets for people who have allergies, help with ADHD as well. So basically an elimination diet, you go all the way back to foods that are known not to cause a lot of problems, and then for at least 2 weeks, and then you slowly reintroduce other foods, every 3 to 4 days. However, I would recommend we do a nutritional visit. Yeah, because I don't want you to suddenly have a nutrient deficiency because you're not doing this properly, and then you are not eating anything at all. ADHD gets worse. So, I would not recommend doing that without the supervision of a physician. We can talk about nutrition. You're not a secret doctor. Talk about it. Something else to consider, and very highly debated. There is not, so evidence for organic foods, highly debated. There is not solid, like, evidence to where your physician can be like 100% you should only eat organic. I'd like to say that. I may be like everybody else, but be careful what you believe, because there's also money on all sides of the equation, right? There's money in the big farm companies that don't want you eating organic, and there is money in the other companies that do, right? So, always follow the money. Where does the evidence lead? Glad you asked. So, there was a study. Children who eat organic produce have lower levels of toxic pesticide chemicals in their blood than children who eat non-organic. Does that affect attention? Not enough. We don't have a lot of studies on that. Okay. So mineral levels in food that have been tested since about between 1940 and 1991 have fallen about 76%, according to one study. I will try to link these studies below, right? Organic crops tend to have more minerals. We talked about these minerals are good for your body, good for your attention. I don't have any study or something that says that non-organic food is going to affect your ADHD. This is the information that I have. This is the only studies I have. You can get more omega-3 fatty acids from cows that have been eating those omega-3 fatty acids, right? So that in that way, I can tell you for sure that organic foods are a little better. But otherwise, I actually can't tell you very much specifically about organic and ADHD. And everyone's different. You may have that experience where that food sounds better for you. But it's important also to consider your stress level, right? I don't want you to get so stressed out every time you go to the grocery store because you're looking for a specific kind of organic food and then feel guilty because you can't find it and you can't eat organic and blah, blah, blah. And you get discouraged. With all of these things, I don't want you to feel guilty. I want you to try to incorporate it one at a time, little at a time, because you can be overwhelmed. Right? You do the best you can for you. Okay? So, try it, don't try it. Look into it. Okay? I wouldn't spend too much time on it. I would focus more on the things we have evidence for, because you can make a lot of these changes we have evidence for, right? The exercise, we have evidence for that. The omega-3s, we have evidence for that. Those are changes we can make. The other changes with less evidence, look at them down the line. And if we want to look into it, do it. Yeah, absolutely. I'm definitely not downing. I prefer, my goal is to grow all of my own food. But I also can't tell you that to do differently than me is wrong, right? And the reason I can't tell you is because I don't have evidence for it. So, I personally think organic is better for you. There is not evidence, again, that will affect your ADHD. You kind of see where I'm going? Like, I cannot let, and this is a problem that a lot of us have as physicians, we let our own beliefs and preferences get in the way of the treatment of the patient, right? We do it without noticing it. I don't want to do that too, so. And make sure, when you're looking into stuff, you don't let your own beliefs and preferences, and that's hard, right? And we not let our own preferences get in the way of our own care. Absolutely. Alright, so we talked about diet. Let's talk about stress regulation. Sure. I don't think that pulse is a particularly good way to measure stress levels. It can be. When you're stressed, your pulse will go up. Yes. A good question. There's a couple common sense stress management strategies. One of them is gratitude. Get in the habit of listing 3 things you're grateful for before bed. I know, I need to do this and I have trouble doing it. Counting, count to 10 before reacting. Very stupid, but common sense strategy. Know your own early warning signs for stress. Are you clenching your jaw? Is your face getting red? Are you feeling hot? I know I start feeling jittery and hot, and then my mouth starts to run very, very quickly, and I don't have control. That's a stress sign. Clenched hands. Know yourself. Plan activities based on whether you're a morning person, a night owl, an auditory visual learner. Know those things. Oh yeah, we can talk about that kind of testing. Absolutely. That's another visit. This one's already longer. I intended, not because I don't have time, but because you also have other things to do in life. Rehearse. Anticipate difficult situations. Role play them in your head. Visualize them. This is not the same as obsessing over them. Don't sit there and think the same thing over and over again and come up with the same bad scenario. Don't do that, please. Think positively. Think, okay, this is what I'll do if this comes up. And this is an image of me winning. This, think good thoughts. Plan ahead. Other things that can help stress, moving meditations like yoga, qigong, tai chi, blah, blah, or sitting meditation, whether that's religious meditation. I like to meditate on different Torah principles, the Tehillim or Psalms and other things like that. You might find other things more helpful. It's religious meditation, it's an option. It's different than concentration meditation, stillness meditation, other sitting meditation types. There's a lot of things. These things have been found to be helpful for stress. A lot of evidence for that. Okay. I think we might have hit on almost everything. Oh, what's the evidence? Oh, yeah. More focused EEG patterns. Regular meditation practice actually changes your cortical blood flow. It increases blood flow in areas that deal with attention, focus, planning, emotional self-regulation, mood. Oh, you're going to have home bibliography below. Yeah, we can do more. We can do a visit about meditation, different kinds of meditation, what will work best for you. For now, let's just get the broad strokes down. I make a lot of painting metaphors. I really like this painting. And then we'll get the more details be careful when looking for meditation advice, recommendations for health, because there is no formal certification for health meditation, right? National certification for mind-body training. Always have to provide what their experience is, what they've done before, and honest providers should be comfortable telling you. Yep. For young children, 10 minutes of meditation twice daily. School-age children, or you, 40 to 60 minutes a day. That's so much, I know. But that can include something like yoga, tai chi. That can be part of your exercise time, too. Exactly. So, biofeedback, another option. I would love to get you into some biofeedback. There are different EEG frequencies that correspond with alertness and processing. The beta wave above 14 hertz is active processing. The alpha wave between 8 and 13 hertz is, active alert. The theta wave from 4 to 7, transitional state. That's when you're in imagery, relaxation, meditation, those kind of associations. Okay. Biofeedback is a way where we measure the EEG patterns while we try to help you to control them, better get which waves you need. Insurance will usually pay for EEG biofeedback. That's done by a professional psychologist, so I can refer you to. Yeah, no, I don't do that. I wish I did. One day I would. Oh, yeah, absolutely. It's actually as effective as many other standard therapies, like integrative or CBT, other behavioral strategies for ADHD. They found that it could improve your IQ, behavior, other kind of things, and scores-wise. Well, we should have a debate about the value of the IQ score at some point because it is not universally useful. But anyway, it is a way to measure, and it got better with these. Well, even with people who were suffering intellectual disability, it used to be called mental retardation, or were on the autism spectrum, but also had ADHD, even those patients found help with the EEG biofeedback. Absolutely. I need you referred. That's a lie. I cannot get you referred. I'm your secret doctor. Ask them about it. Okay. I know. This is very scandalous, having a secret doctor. I'm your secret pocket doctor. So, large studies suggest that at least in the short term, most effective therapy for ADHD is both medication and some kind of counseling, cognitive therapy. Cognitive behavioral therapy, CBT. Ask your physician about someone who can do that. Okay. Negative self-labels from your behavior cause you to blame yourself. It can cause oppositional behavior. You can get other social problems because of how frustrated you feel about your own performance with ADHD. Yeah, absolutely. Professional counseling, metacognitive therapy. Let's see what else. Ask about getting special psychological testing. I'm actually in line for my special psychological testing now, because sometimes you can find about other, oh no, not physically now. Now I am with you, but you can sometimes find other things that contribute to your difficulties. You might have a learning disability you don't know about. You might be a little bit on the spectrum. And those, helping identify those things and finding the appropriate treatment for those things can help with your concentration as well. In our patients who are above 65, concentration deficits actually usually can indicate depression. Well, that's why we did that whole diagnosis visit already, where we went through all the different possibilities of what you have. No, that's not the same as psychological testing. That's diagnosis for some things. There's an additional level of testing that has to be done for certain conditions. So, social relationships. Get you in a support group. Well, you can think about it. Yeah, absolutely. ACOM, all kinds of minds. Non-profit organization. I love that title too, all kinds of minds. There are all kinds of minds, right? Children and adults with attention deficit hyperactivity disorder, CHAD. I know there's a lot of information. You can see why I have it in front of me as well, instead of just trying to, because it's a lot. Again, you write it down. That's CHAD with another D at the end, CHADD. The National Federation of Families of Children's Mental Health, parent-run organization, kind of support family. Learning Disabilities Association of America, founded in 1963. They've also got state chapters. And the Mental Health America, formerly known as the National Mental Health Association. They're the oldest community-based network that we're talking about here. They kind of do a lot of advocacy. They helped with the Mental Health Parity Law, 2010. They do a lot of advocacy. If there is a problem for your family member, your child, your sister, there is a 1999 addendum to the U.S. Individuals with Disability Education Act, that's the IDEA Act, found that, saying that with any kind of disability or needing special support, I don't like to think of ADHD as a disability. You can still work, you just need adjustments. And it's adjustments to work in this society. You might do very well in a different one, right? So, But anyway, having any kind of disability, neuroatypical, you know, those children and youth need to get special services or accommodations that address their problem and help end its effects. So that's called FPPE, FAP, the free appropriate. I talked to a lawyer about this. Basically, the rule is it has to be free, it has to be appropriate. It has to be appropriate to the issue. If it is not appropriate to the issue and not evidence-based, for example, if your child with autism isn't getting ABA, then you need to fight for that. You have to be getting what you need to get, because otherwise that money's going to pencils and sports teams. I know, so political. Oh, gasp. Okay. Section 504 of the U.S. Vocational Rehabilitation Act prohibits discrimination against any person with disability. And under that section, you may get special services like a smaller class size, tutoring, modification of homework assignments, etc., etc. Obviously, there can be a tendency when you over-advocate, where you victimize yourself a lot. You're always fighting to talk about your issues so much that you identify very strongly with them and never think positively about driving forward. Right? I don't want you to do that. I don't want you to associate those things, but you have to stand up for yourself. You need, within reason, which is why it's good. And I don't mean to say that you shouldn't stand up for yourself. That's not what I'm trying to say. I'm trying to say be careful about victimizing yourself. Be careful about always saying, I can't do this without help. I need help. I need help. I need help. Because it can make you actually not get better. Because it's all about that mentality, right? Having those positive mental associations. On the other hand, you have to have a realistic mentality. If you need help, you need help. Right? If you need that smaller class size, you ask for it. You gotta get what you need to get. If you haven't gotten sufficient services for your child within 6 months, I'm gonna have to take that out. Within 6 months of, and I'm like Pickle Rick over here. Within 6 months, 6 months of asking the teacher or principal. If you have not gotten sufficient help within 6 months of asking the teacher or principal, write to the district and keep moving up. Talk to attorneys. It's in the law. So you may need a specific evaluation for learning disabilities. You can get IEP in place. That is a individualized education. Let's see. Environment. I've talked a lot about how the social environment around you can affect ADHD. Right? Let's talk about, just for a second, think about things like smoking, alcohol, illicit drugs. Adults who are using those as primary stress management strategies, that, since they're unhealthy stress management strategies, they don't work long term. If you're around that kind of environment, that also can harm you. So trying to get a positive environment. Having music in your area, good music around you, getting that environment for your brain, using it as a learning strategy. Songs with rhymes, something memorize things, right? Calendars, schedules, how can you modify your environment to support you? And that's what a lot of this conversation is. Additional foods. There are botanical options. Melatonin does not improve daytime symptoms of ADHD. They've studied that. But it does help your sleep. Especially in day shift workers or people with delayed sleep phase syndrome. And we'll do a whole visit of that sleep at some point. One study, children with ADHD, found that 4 years later, more than 2/3 of those children still continued taking the melatonin they'd started 4 years before. Because they found it helpful and there were no side effects. So it's useful. It can have side effects. They had no side effects. Yeah, we can go back to environment again. It's not a problem. Hey, I jump around, you can jump around. I'll give you a couple more. Spend more time in nature. Be mindful about how you use music to calm, focus, and re-energize you. Schedules, proper safety equipment, clocks, calendars, lists. Don't spend more than 2 hours in front of electronic devices daily. That is impossible for some of us. Right? Some of us, that is our job. Like, I probably spend most of my day in front of an electronic device because of how dependent that electronic device is now. I'm in front of an electronic device right now. Get yourself breaks as you can. Right? Stand up, stretch. I'm going to take a second. I'll smoke. Yes, I'm smoking it all the time. I'm a tobacco smoker. Avoid being around tobacco smoke as much as you can. Okay. So, yeah, I know you wanted to talk about herbals. That's what you wanted to talk about at the beginning of the conversation, right? When we talked about alternative medicine. The best alternative medicine is actually lifestyle modification. There's no magic pill, either in traditional medicine or in alternative medicine, right? However, there are some calming herbs that have been used to help decrease agitation, help with focus. Chamomile, hops, kava, lavender, lemon balm, passion flower, and valerian. They may promote sleep. They're not usually helpful for calming daytime hyperactivity or inattentiveness or stimulants are usually better, right? Things that stimulate the part of your brain that controls the other parts of the brain. Because that's actually what stimulant medication is doing. Stimulant medication isn't calming your brain down. It's stimulating the part of your brain that controls it. Right? So green tea, caffeine, those kind of things. No controlled trials are available to demonstrate significant benefits of things like ginseng or other stimulant herbs for ADHD. Okay? There was one pilot study from Italy about ginkgo. Ginkgo can have serious side effects. You can bleed to death because you're taking ginkgo. Okay? We can have a conversation separately just about ginkgo, right? If that's something you're interested in. But be careful, don't take any herbals without talking to somebody about it. There is a Canadian product called ADFX that combines ginseng and ginkgo that benefited patients with ADHD and dyslexia in one study that was sponsored by the manufacturer. Right? It's all about money. There's money on either side. And the study might still be true, right? Okay. But with all of that money, picmogenol or European pine bark extract was significantly better than placebo, but though in several psychological studies done by European companies who were selling that product, picmogenol. Neither evening primrose oil or St. John's wort supplements have proved any more useful than placebo. Okay. So, really, you should wait. We should really wait until we've had better studies about these products before we make a final, before we try to take them. Because you can get side effects and die from these things. Okay. Like of the calming ones I mentioned, kava, hepatotoxic. It can cause your liver to shut down. I would feel safer if you're taking teas like chamomile, hops, lemon balm, passion flower, valerian tincture. Aromatherapy is fine, chamomile or lavender, or teas of black or green and coffee. I would recommend doing that instead of taking a lot of this other stuff. Okay? Yeah. That sounds good. Okay, we'll talk about those too. Because you're right, there are side effects for all kinds of things. Let's talk about our other stimulants. So, the British National Institute for Health and Clinical Excellence, or NICE, recommends stimulant medications as first-line therapy for adults with ADHD, but not as first-line for children, only children with severe symptoms. In the US, stimulants are first-line for children. Long-term effectiveness of this strategy is unclear. Right? Stimulant medications do not usually improve oppositional or defiant behaviors. That's important. Okay? A lot of the studies that support use of these psychostimulants were funded by the companies who make them. And there are some studies from non-paid researchers, not paid by the companies, that found they were very little better than placebo. So I think it's fair to have concerns about stimulants, just as I might have concerns about you taking kappa or ginkgo. But better than placebo is still something, and a little better than placebo is still something. So there are various options available. Stimulant medications can be short-acting, like 3 to 6 hours, or long-acting, like a 24-hour cycle, or more than 8 hours. Okay. All of them come from methylphenidate, which, yes, has meth in it for a reason. Yeah, Concerta is the one that we were talking about. Yeah, because you said you took Adderall. Yep. That is a combination of amphetamine and dexamphetamine. Usually taken 10, 20, 30 milligrams a day, twice a day. Ritalin, Focalin, Metadate, Methylin, these are all short-acting options. The long-acting ones are like Concerta. You can take that like once a day for the whole day. Focalin, Adderall, Vyvanse. Those are more long-acting options. Adderall XR we'll use for children. Usually the other ones we'll use more for adults. And then, of course, there's medium-acting. I've actually never seen anyone use the medium-acting. When I prescribe them, I'll do one long-acting, and then if that doesn't work, we'll add a little booster in the afternoon. So we'll do a long-acting and then an afternoon booster of a short-acting. The weight loss that you mentioned is a major side effect. And again, we always have to take EKGs and make sure there's no palpitations, no family history of heart issues. Because some of these can, they can affect your heart. I wouldn't say they're cardiotoxic, but they can affect your heart. Insomnia is another side effect. Some people get drowsy on them, which is unusual, very rare. Oh yeah, psychosis, hallucinations, death, like sudden random death. Those very, very rare side effects absolutely can occur. It's true. But that's why we always check before giving those medications. We try to check, does this person have a clean bill of health? How's their heart? What kind of things could cause problems? Oh, absolutely. Just like you can bleed out from ginkgo. You just bleed to death. You take the ginkgo, you bleed to death. You can take some Adderall, and your heart can stop working. You can be that unlucky bastard. Fear everything. No, my point is actually not that you should fear everything, but that everything carries a risk. Medicine is all about risk assessment. What is going to cause you the greatest risk? And what is going to cause you the least risk and have the most benefit? And in a lot of people, a stimulant medication is less risk than, because most people, especially most people, I have never had a horrible side effect like that with any of my ADHD patients, right? It happens. It is a thing that happens. Thank goodness I've never experienced that. And studies will show you, like the FDA studies for safety and everything else, found that you couldn't really prove that this was something that they were causing consistently, right? So these are medications that are safe. However, nothing is safe, right? You see kind of that paradox. Well, and that's why when we give them out, they're very controlled. Here, when I'm re-prescribing them here for people who need them, I'm only giving out like a month at a time. Sometimes 2 months. I can give up to 60 days at a time. Yep. Absolutely. So why do some people choose to take them? Well, for some people, people who have a clean bill of health have a low risk of any kind of these health side effects. The risk of struggling, in their employment and not being able to work, the risk of being unable to, work with other people in a way that other people can understand, the risk of basically becoming isolated, of suffering, that's a high risk, right? Or the risk of having safety problems because you're so impulsive. If you get distracted by something, get run over by a car, or ADHD can kill you also. Everything can kill you. Some people, those risks are much greater than the risk of being on a stimulant medication. And that's something that we have to take into account, right? How do I find the best option for the least risk? I agree that for you, with mild to moderate symptoms, medication might not be the best option. If you have very severe symptoms, something to think about for the future. So, medications are not a cure, though. They can't work unless you take them consistently. You have to take it regularly. If you stop taking it, it stops working. More than half of patients with ADHD kind of stop taking them without talking to their doctor. Talk to me so that we can do something alternative to help you out. Right? On the other hand, people get reliant on it. That's the other end of the spectrum. Long-term costs, long-term effects. So, check and evaluate what's going to be useful for you. For some patients, medication is the right answer. You'll hear people who are like, my medication saved and changed my life because I was able to operate and have a happy life and talk to people, and I didn't feel like I was being controlled by something else because my brain was going all over the place. Right? I was able to have peace with myself. That's a big deal. That's a big benefit. Well, that's why we do those tests beforehand to make sure everything's safe. Yeah, there's a couple other options. We won't end on medication. There are some studies supporting the regular use of massage for ADHD because, improving blood flow to the whole body helps blood flow go to your brain. It affects those neurotransmitters, right? Reduces stress. Actually, even a 15-minute chair massage can improve your accuracy and speed on standard time. There is a service to find a licensed massage therapist. The American Massage Therapy Association's locator service. That's one to write down, right? Absolutely. I think that's all that I have for you. Do you have any questions for me? I know, it's such a downer. Such a downer to end on. Everything can kill you. You know what can't kill you? Lentils. Lentils cannot kill you. Lentils have good omega-3. I would focus on the ways that things can help you. I think we have a tendency to focus on the negative. And I lied, I'm totally going to eat an orange now. I love the sound. Not a lovely sound. What a lovely little orange too. I'm listening. I think that's a fair concern. I think that I've given you a lot of information today, and you should wait to make a decision. You should go talk to your non-stimulant doctor about it. Because you seem to be very interested and also afraid of medication since it keeps coming up. And I think you shouldn't take anything that you're not comfortable with, because you need the placebo effect to help you. Right? They are more effective than placebo, but you need that placebo part. I believe very strongly in using the placebo effect for your Like I said, some patients is very helpful. Not every patient with therapy should be individualized. Some people need stimulant medications, and some people should avoid them. Like if you have a crazy heart condition. Here comes Mango again. There's a little bird over there. There's also a naked person standing just off camera. They don't really make a sound next to each other. The sound of them tearing away is great, though. I don't know if you can hear that. Alright, folks. You kind of like orange? Thank you. I hope that I've been able to assuage, A-S-S-U-A-G-E, some of your fears, help you feel a little better, relaxed, help you understand that you're not alone in this journey. It's very doable. It's very reasonable. There are a lot of alternative options, and